Newsday continues here on One News Now. I'm Charles Lehan. The Octa Research Group warns that the Delta variant must not be underestimated. This as the country's COVID-19 cases climbed to 5 digits in 5 straight days. Arian Kalumbiran with the details.
For the 5th straight day, COVID-19 cases recorded in the country have reached 5 digits. Yesterday, the Health Department recorded over 14,700 new infections. That's the new second highest single-day tally in the country. The current record of highest new COVID-19 cases in a day is 15,310, reported on April 2. And after 4 months, active cases in the country have again reached the 100,000 mark. For the 4th straight day, over 200 COVID-19 deaths were reported. Over the weekend, Health Undersecretary Maria Rosario Vergere reiterated her warning that hospital bed utilization in over 50 areas in the country have reached alert level 4.
Ngayon po, meron tayong 54 areas nasa level 4 alert. Pag sinabi po nating level 4 alert, more than 70% na po ang utilization ng kanilang mga ospital.
The DOH is currently coordinating with the Interior Department to speak with local hospitals and instruct them on the next course of action.
Then we are further expanding the capacity of our hospitals. We are now using covered courts in hospitals. We are using function halls, conference rooms. Kino-convert na ho natin yan para malagyan natin ng kama. Gumagamit po tayo ng mga modular hospitals. Gumagamit tayo ng tents.
The Octa Research Group admits that current COVID-19 data is not aligned with their projections. They said that by now, COVID-19 cases should be slowly decreasing after hotspots concluded their first week of ECQ. In Metro Manila alone, reproduction rate has climbed to 1.78 on Friday. By Sunday, this went up further to 1.9, while R0 in the entire country has increased to 1.5. Hospital bed occupancy in NCR is also now at 64%, while ICUs reached 71% for the first time since May.
Baka the Delta variant is more than what we anticipated it to be. Yes, mas malakas siya than we thought it was, meaning yung infection rate niya na sabi nila 50% more transmissible than yung Alpha or yung Beta variant. So we're seeing the effects now of that.
But it's also possible that the current ECQ is not as strictly implemented as previous lockdowns. Despite this, Octa hopes that numbers will decline as the ECQ continues to be in place. But for now, an extension of ECQ has yet to be declared in Metro Manila and other key areas.
Probably too early to say right now, but what I'm sensing is that, as I mentioned, in Delta variant, we should not be underestimating it. It's proving to be a very formidable, enemy of ours.
Arian Kalumbiran, we are One News.
Health workers insist that they will push through their mass resignation should the government fail to provide the promised benefits to their sector. This was confirmed by the Alliance of Health Workers National President Robert Mendoza in an interview with Radio 5. Mendoza said that medical frontliners should not only be given special risk allowance, but also meals, accommodation, and transportation allowance for their work. That's on top of increasing their base pay for medical workers.
Alam naman natin nung SWO na pinasalamatan ni Presidente Duterte ang health workers. Pero ano yung pasasalamat mo? Hindi naman sinasabi natin na mukhang pera ang mga health workers. Ano yung akibat na para doon sa health and safety, ang protection, welfare ng mga health workers sa panahon din lalo na merong Delta variant?
On the other hand, the health department had earlier urged healthcare workers to talk to them about their issues to reach a resolution that is favorable for both sides.
Kami po ay nakikiusap unang-una na sa ating mga healthcare workers, kung meron po tayong mga hinanaing, kami po naman ay patuloy na nakikipag-ugnayan sa mga organisasyon ng healthcare workers at amin pong pinapakinggan ang kanilang mga dinudulog at kung magagawa namin agad-agad, ginagawa namin agad-agad.
The Quezon City government is filing charges against 2 individuals that have secured booster shots at the city's vaccination center. This comes after the LGU received a report of one individual who had been fully vaccinated with Sinovac in Mandaluyong City, later registered in QC to get a Moderna shot. while another individual also bragged about receiving a Pfizer shot in Quezon City after getting 2 doses of Sinovac. In a statement, Mayor Joy Belmonte condemned this action of what she describes as greedy and selfish individuals. Belmonte said that they will not tolerate such actions, especially since many people have yet to receive any vaccine. On the sidelines of the latest arrival of Moderna vaccines, vaccine czar Carlito Galvez Jr. said getting booster shots is still forbidden in the country. That's because more than 90 million Filipinos have yet to be vaccinated against COVID-19.
We are asking our people to be patient. Kailangan we have been morally obliged that we need to wait for our turn. At the same time, when we are already finished, let the other people also finish their turn. Nakikita natin, sinasabi nga ng mga expert, yung booster shot, walang ganong epekto yan kung ang ating spacing napakababa ng spacing natin. So meaning, it will take more its efficacy once we have already reached more or less 9 months or 12 months. Kaya nga ang sinasabi ng expert natin is mas maganda ang booster natin.
Vaccine czar Carlito Galvez Jr. vows that more vaccine doses will arrive in the country this week. In a briefing on Sunday, Galvez said more or less 5 million more vaccine doses will be shipped to the country over the next few days. 14 million more doses are seen to arrive until the end of August, and he estimates that the country can reach its target of vaccinating 15 million Filipinos this month.
Kailangan ang pinaka-primary objective natin ay magkaroon ng steady supply. This coming August, this August, and also September, we will be having more or less 20 to 30 million doses. So we are expecting 14 million more before the end of August.
Philippine General Hospital has decided to temporarily stop accepting non-COVID-19 patients. In a statement, PGH said it needs to focus on treating the rising number of COVID patients as it remains the COVID-19 referral center of the country. The hospital assured the public that they will announce any changes in their operations as soon as possible. As of August 14, there are 262 COVID-19 patients admitted at PGH. 260 of them are confirmed cases, while the rest are probable and suspect cases. Since February of 2020, the hospital has treated over 5,000 COVID-19 patients, and more than 4,000 of them have already recovered. How will we be able to stop the spread of the Delta variant? Johns Hopkins' Andrew Pekosh gives us 5 tips to contain the more contagious variant on Bloomberg Quick Tip.
Scientists think that they're caused by small microorganisms called viruses.
1, 2, and 3 would probably be vaccines. We're seeing unvaccinated people are forming the bolus of cases that are now swamping our medical institutions in large swaths of the country.
Ah, yes, there are remedies galore.
So vaccination would keep people out of the hospital. And that is the most important thing that vaccinations can do. Oftentimes, one thing can't protect us completely.
Saliva mucus.
And so, especially with viruses spreading as freely as they are in many parts of the US and the world, it's not a bad thing to have a little social distancing,
Stay home.
to have your mask handy, to be able to have more than just your vaccination status be able to protect you. It's just going to be temporary. Delta will get under control, and if we can boost the vaccine programs while we're getting Delta under control, then we'll be in a much better place in a couple of months.
To fun, to play.
But it really starts and ends with vaccines, but things like social distancing and masks are going to help the vaccinated people
Go to bed at a reasonable
be a
hour.
little bit more safe, especially when there's lots of virus going around.
Rest. You might as well make the best of it.
Here's a quick look at some of today's headlines. Bulacan, Laguna, Iloilo City, and Cagayan de Oro are back under MECQ status starting today. The Philippines has recorded its first case of COVID-19's Lambda variant. And the Octa Research Group sees COVID-19 infections still increasing in Metro Manila despite the 2-week ECQ. And those are the top stories at this hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.